Have you ever wondered how this massive, almost unimaginable ocean of healthcare data, we're talking millions of records from thousands and thousands of people, can actually be used to answer a single life or death question for just one person? Well, today, that's exactly the journey we're going to trace. We're going from one patient's question all the way to a hidden pattern in the data that could save her life.
So let's start with who this is all for. This is Laura. She's a teenager, and she's dealing with a chronic disease called lupus. Right now, she's in the middle of a bad flare-up. And it's not just that. She's got some really serious complications. The big one? Inflammation and antibodies in her blood that put her at an incredibly high risk for a dangerous blood clot. I mean, the stakes here could not be higher.
And this puts her doctors at a huge crossroads. They have a massive decision to make. Should they put her on a powerful anticoagulant, a blood thinner? Because that medicine carries its own serious risks, like major bleeding. This is the kind of decision that changes a life, for sure.
Laura's urgent question is really what kicks this whole thing off. It forces everyone to step back and ask, where do we possibly find the right answer when the stakes are this high?
Now, you might think, well, can't they just look it up in a medical textbook or call up some experts? And sure, they could. But for a really complex case like Laura's, those traditional ways might not be enough. The real answer, the one that could give them confidence, well, it's hidden somewhere else. It's buried in the electronic medical records of thousands of other patients who are just like her.
So, to find that answer, we've got to zoom way out and take a look at the massive, kind of messy ecosystem where all this data actually comes from in the first place.
And this image right here, it perfectly illustrates that universe. It's not some neat, tidy database. No, it's more like a living, breathing ecosystem. You can see the flow here. Data is moving from patients to hospitals, from doctors' offices to insurance companies, to labs, to researchers. Every single one of these interactions generates another little piece of this giant data puzzle. Okay, now what's really fascinating here is that every single player in this system has different goals. Think about it. A patient, their only goal is to get better. A doctor wants the best outcome, but they're also trying to minimize any harm. And then you have a government regulator who's thinking about the big picture, what's cost-effective, what's best for society as a whole. All of these competing interests actually shape the kind of data that gets created.
So, with all that complexity, how on earth do data scientists actually navigate this whole thing to find a clear answer for Laura? Well, it turns out there's a playbook. It's a structured 4-step process.
It's really like a treasure map for finding insights. Step 1, you have to pose a really clear question. Step 2, you identify the right places to look for the data. Step 3, and this is a big one, you extract and transform all that messy data into something you can actually use. And finally, step 4, you analyze it and draw your conclusion. It's a logical path through the chaos.
Okay, so let's plug Laura's case right into this workflow. The question is crystal clear. Is this risky treatment warranted? The data source? The hospital's own electronic medical records, or EMRs. So the team queries those records, looking for other pediatric patients with the exact same diagnosis codes and lab results. Basically, they're finding Laura's data doppelgangers to see what happened to them.
And this is the answer they found. The analysis showed that patients just like Laura have twice the baseline risk of developing a dangerous blood clot. So, that single number, that 2x, it made the incredibly difficult decision clear. Her doctors decided to go ahead and treat her with the anticoagulant. That 2x result seems so simple and clean, right? But getting there is anything but. It's actually an incredibly complex process. So let's talk about how you take all these messy, raw medical records and turn them into a powerful insight like that. All right, first, you've got to understand that data basically comes in two main flavors. You've got structured data. That's the easy stuff. It's already organized in neat little tables, things like lab results or billing codes. Then you have unstructured data, which is, well, everything else. We're talking about doctors' free-form notes, medical images, sensor readings, all the complicated, messy stuff that actually holds some of the most valuable clues.
And this, right here, is where the magic happens. You take something like a doctor's dense, unstructured clinical note on the left, full of shorthand and medical jargon, and through a whole lot of processing, you can turn it into what you see on the right. Data scientists call it a patient feature matrix. Now that sounds super technical, but it's just a fancy name for a clean grid where every row is a patient and every column is a specific measurable thing about them, like their age or blood sugar. Now it's ready for analysis.
And this whole process of creating those columns, or features, has a name. It's called feature engineering. It's really part art and part science. It's where you use your expertise to create brand new variables from the raw data that weren't there before,
like, say, calculating a body mass index from a patient's height and weight. These new features can make your analysis way more powerful.
But here is a really important twist in the story. Just because your data is sitting in a nice, clean table doesn't mean it's perfect. In fact, the data that we rely on so heavily can have all sorts of hidden flaws.
Yeah, as the source material for this explainer points out, and I love this quote, this data is really just a byproduct of the day-to-day running of the healthcare system. It wasn't collected in some perfect, sterile lab for a research study. No, it's messy, it can be biased, and it absolutely reflects our imperfect world.
And this diagram shows just how easily that bias can creep in at every single step. Look, right at the top, a patient's own decision to even go to the doctor in the first place creates what's called a selection bias. Then, a doctor's own subconscious biases might affect their notes, or a billing clerk could enter the wrong code. These errors and biases can get baked into the data all along the way. Knowing where to look for them is absolutely crucial.
So we've seen how this incredible process can literally answer a life-or-death question for one person. But what does it all mean for the future of medicine? Where is this all heading?
But what this whole workflow is pushing us toward is a future of truly personalized medicine. A future where treatments aren't just based on some average patient you read about in a textbook, but are tailored specifically to your unique data profile. Just like they were able to do for Laura.
So what's the big takeaway here? At the end of the day, it's about understanding that whole journey, from one patient's urgent question to a massive pattern hidden in the data, and then all the way back again to help that one patient. If we can master that loop, we can build a system that makes smarter, safer, and more effective decisions for every single one of us.
And that leaves us with one final and really critical question to think about. As artificial intelligence becomes more and more a part of our healthcare and it learns from this exact same data, how do we make absolutely sure that the data itself isn't just accurate, but that it's also fair and equitable for every single person, no matter who they are or where they come from? That is the challenge and the responsibility ahead of us.